Good morning all of you. Today we will discuss about antidiabetic agent. So what is meant by antidiabetic agent? Antidiabetic agents are the agents which are used for the treatment of diabetes. What is diabetes? So first we will see what is diabetes. Diabetes mellitus is a clinical metabolic syndrome which is characterized by increase of blood sugar level. So if blood sugar level get increased than its normal level, then the person will cause diabetes. Diabetes mellitus is also called as hyperglycemia. Diabetes has many causes, but mostly diabetes occur because of type 1 type of diabetes, because of type 2 type of diabetes. Traditionally, from ancient time, diabetes mellitus, it is nothing but more sugar in your urine. So traditionally, it is called as the blood or sugar in your urine. It is one of the third leading cause of death and second leading cause of blindness and renal failure in world. There are another classical symptoms of diabetes mellitus like polyuria, polydipsia, polyphasia. Polyuria means excess of urination. Polydipsia means it is your body will be excessive thrust in your body. Polyphasia, it is excessive eating. So causes of diabetes mellitus, there are different causes, but clinically, mainly two causes are identified. First is insulin deficiency. Insulin deficiency, if there is a decrease of circulating level of insulin in your body, then it is one of the cause that is called as insulin deficiency. Second is insulin resistance. It is a decrease of response of target tissue to insulin. That is called insulin resistance. So according to types, as we discussed, there are different four types of the diabetes mellitus. Type 1 diabetes mellitus, which is called as insulin dependent diabetes mellitus or a juvenile diabetes mellitus. Type 2 diabetes mellitus, which is not dependent on insulin. That's why it is also called as non-insulin dependent diabetes mellitus. And third one is other types, which is occur because of different types of diseases or disorder. Fourth type is gestational diabetes mellitus. Type 1 diabetes mellitus, generally it is occur near about 10% of the person, 10% of the population which is suffering from this type 1 diabetes mellitus. The cause of the type 1 diabetes mellitus, it is autoimmune destruction of insulin producing beta cells in your body from the pancreas that results into the insulin deficiency in your body. That was type 1 diabetes mellitus. There are different types of the reasons for type 1 diabetes mellitus, which is caused because of lack of insulin, and that person, that patient required a continuous injection of insulin. So causes of type 1 diabetes mellitus, generally it is a type of autoimmune disease for pancreatic beta cells. There is a degeneration of the beta cells. So there are a lot of causes for degeneration of the beta cells like genetic factor, environmental factor, immunological factor. This type 1 diabetes mellitus again subdivided into two types, type 1A and type 1B. Type 1A, it is autoimmune disease due to destruction of beta cells, and type 1B, it is idiopathic, which is dependent on some other external factor which caused because of viral diseases or either by thyroid diseases. Another case that is occurring with diabetes patient, that is diabetic ketoacidosis. It is the increase of acidic level, it is the increase of ketone level in the body of the diabetic person. So generally this person is suffering from nausea, vomiting, thirst, polyuria, abdominal pain, tachycardia, dehydration and hypotension. Next, type 2 diabetes mellitus. Type 2 diabetes mellitus, it is characterized by resistance of the action of insulin and inability of body to produce sufficient amount of insulin, and it will be insulin is insufficient in the person's body. It occurs near about the person whose age is more than 40 years and a person who is excessive overweight. Generally, type 2 diabetes mellitus is a common form of diabetes, generally occurs to the maximum 90% of the population, and it occurs due to decrease of sensitivity towards the receptor. There will be a decreased response to the insulin. That's why type 2 diabetes mellitus is occur. Another causes related to type 2 diabetes mellitus is genetic disorder, genetic defect. Generally, person is having obesity and there is a lifestyle changes. There is lifestyle changes. So type 2 diabetes mellitus, it is highly dependent on your lifestyle. Then pathogenesis. How this diabetes mellitus, its pathogenesis is here. So genetic factors, there are different factors on which pathogenesis is dependent. First is genetic factor. So if there is an identical twin of parents who is suffering from diabetes, generally this parents is having diabetes and their twins are more prone for the diabetes mellitus. Then there is both the parents are having diabetes, then there is a 50% risk to their child they are suffering from diabetes mellitus. Constitutional factor, like as we discussed, obesity is one of the reasons. So obese persons are more suffering from the diabetes mellitus. Hypertension, it is a close resemblance with the diabetes mellitus for hypertensive patient. Then low physical activity. If person is not doing physical activities, then there may be chances of development of the diabetes mellitus. Then decrease insulin secretion. If the person is having lipotoxicity, then there is a decrease of insulin secretion in the body. Glucose toxicity of isolate cell, it is dependent on it is responsible for decrease of insulin secretion. Insulin resistance, if the patient's receptor or it will be defect having in the receptor, then that insulin resistance is occur. Impaired glucose utilization, if the patient's glucose is not properly utilized, that will result into diabetes mellitus. Then any diabetes mellitus, generally beta cells of Langerhans or isolate of Langerhans, generally it is responsible for utilization of excess of sugar in the body, and that beta cells which is secreted from the isolate of Langerhans, generally this is as it is image of the isolate of Langerhans. Generally, there are 1 million of isolate of Langerhans in the body of the person. Out of that, it is 1 or 2% of the pancreatic mass constituted from that isolate of Langerhans. It contains different types of the cells like beta cells, alpha cells, delta cells, and F cell. Beta cell generally produces insulin, alpha cell produces glucagon. Delta cell will produce the somatostatin and F cell produces the pancreatic polypeptides.